In this first section, we're going to be focusing on engaging the patient. What we mean by that is making sure that very early on as we begin an interaction, that we make certain that we ask for and include the patient's own agenda in today's discussion. To do that, very simply, we want to make sure that we ask questions. We ask questions like, what do you want to make sure that we address today, Mrs. Smith? Could you tell me something that's been tough for you in terms of trying to manage your diabetes or your heart problems? There's a couple things I want to make sure we address here today, but before we do, I want to make sure we make room for addressing what you think is important. So when you think about your diabetes, I'm wondering what are the important things you want to make sure we talk about today or that we try to resolve? What would be useful for you?
Well, the thing that would probably be most useful to me.
By including the patient's agenda in the interaction between patient and provider, our patients will be interested in exactly what we'll be talking about today and engaged and excited about any suggestions we may have for making positive changes in the future. Pat, I'm glad to see you.
Thank you.
There's a bunch of things I want to make sure we cover today, but before we start, I'd like to ask you, what's your agenda? What do you want to make sure we address today? What are some of the issues that are important to you?
Taking my medicine. I don't take it regularly. I was having problems with...
By starting with the patient's agenda, we are guaranteeing the patient that today's visit will be of personal interest to them. Therefore, they are more apt to feel engaged almost immediately. Of course, this does not mean that the provider's agenda for the current visit is not important, merely that it should not come first.
Paul, it's nice to see you again. And there's a bunch of things I want to make sure we cover today, but I know you may have some of your own issues and concerns. So first of all, let me just ask you, how are you doing with your diabetes? How well are things going, or how poorly are things going?
Well, my diabetes is not going well at all.
Mm-hmm.
My sugars are very high. My average is about 288. I'm getting more and more depressed with it. I stay in bed because of it. I don't want to face the world. Sometimes I feel like there's no reason to go on. I do what I'm told to do, taking my insulin properly, trying the new types of drugs that doesn't seem to do any different. Try to eat like the doctors say, the dietitian tells me, and it doesn't seem to do anything, and my sugars just seem to stay high.
You're getting pretty discouraged, and it sounds like for good reason. If your best efforts aren't leading to the results you want, you're getting pretty depressed. And certainly we know the hallmark of getting depressed, or one of them, is when you feel like you're so tired you can't even having to get up and go to get out of bed in the morning.
Right.
By the way, another common symptom is when people feel like they're losing their ability to enjoy things. Have you noticed that as well?
I diagnosed 10 years ago with diabetes, and I've seen it just really just take over my life. Not, I can't be in charge of it. It ruins everything. I can't do anything normal, and I want to be normal, like a normal person. So instead of facing what I have to face on a daily basis, I stay in my room, in bed, and I'm weak, and I have other health issues, so the diabetes is just taking over, and it's not, I think that it's not fair, and I get very angry, and I hate diabetes. I hate even the word.
If we did something useful today so that your time here would be worthwhile, what would we accomplish?
A reason to want to do better.
We must remember that we and our patients are on the same side. And working within very limited time constraints, we must find a way to encourage them to believe that managing their diabetes is worth their while. Often this does not seem so easy, but it is one of our most critical jobs. Otherwise, our many prescriptions and recommendations may come to naught.
My caretakers tell me that I should eat every 4 or so hours. Should eat so many snacks a day and so many meals a day. And with my schedule, it's very hard for me to do that.
Tell me more about that. How does your schedule conflict with this idea of eating multiple times a day?
Well, one reason is I'm usually up early in the morning time. And usually when I get up that early, I'm not hungry.
Okay, so one is you're just not hungry. The other is you get busy with other things, like work.
That's true.
Or other things?
Work or any other activities. And then I just totally forget about eating.
Sounds like you get pretty focused on what you're doing.
Yeah,
And,
and-
eating is just not very important.
And then I realized that at the end of the day is almost ended before I'm hungry or before I really want something to eat.
An important part of engaging the patient is being curious enough to drill down with them to get more details. Since the focus of our efforts is on promoting behavior change, we must do more than just listen to the patient's story. Instead, we want to focus very actively on identifying some important areas where the patient may be interested and willing to make positive, healthy behavior changes. To be truly successful here, we would not do this by simply stating our own goals for the patient. Instead, we would help the patient identify from their own perspective the necessary changes that need to take place.
I know you're on a bunch of different medications, and I know the diabetes medications you take are glipizide and metformin. And I noticed that just talking about this, though, it looks like it's really upsetting for you.
Yeah, it is, because I don't like to take medicine. I hate to take medicine.
I got the sense that taking medications for you, the more pills you take, it's almost like it's a statement that you must be really sick.
I don't feel sick, but I know I am. I have type 2 diabetes, and I have thyroid problem, and they said I had 200 and something for cholesterol, so they gave me a pill for that, and high blood pressure, and they said they were giving me high blood pressure medicine because they were giving me diabetic medicine.
We as providers don't often ask our patients to explain why they are making the decisions they are making. From our perspective, patients often make choices that are not grounded in common sense, choices that may even seem potentially harmful to them.
So when you think about taking these medications, you said you've really stopped taking most of them over the past month, or really not taking as much as you need to. How come?
Well, I was stressed. I was stressed, and I didn't want to take them. And then when I was taking the medicine, about 2 o'clock or so, I started shaking, really shaking. So I had to go rush and find something to eat real quick. And then when I wasn't taking the medicine, I wasn't getting this feeling. I was feeling healthy. I was feeling okay. But I know I have to take the medicine.
So there's something about the medications you're taking, and in particular we know it's probably that glipizide you're taking that was actually causing you to have these low blood sugar feelings. And I guess that makes sense. If you're taking a medication, you're not really aware of it having any benefit, but you're aware that it actually feels like it's making you feel bad. I can see why you wouldn't necessarily want to be taking it.
Yeah, because
We must believe that because they come to us, they do want to live long, healthy lives. Indeed, most patients do understand that diabetes is a serious disease that can be harmful to their health.
I know I have to take the medicine for my own health. And I've been going to diabetes classes for 4 years. And
The critical issue is that there are often an array of problematic barriers, personal obstacles that stand in their way. To address these barriers, we must first make the effort to understand the problem of diabetes from the patient's perspective. We must make this effort before we offer our own advice.
A couple hours before I go to bed, which is around 2 o'clock, then I want to eat. And when I eat. I don't just eat a little bit. I guess I make up for what I didn't get that day. And so then I'm really, really full. And so the next morning, then I wake up, my sugar is really high.
Well, no wonder you're not hungry in the morning. You're still full from the night
Still full
before.
from the night before, you're
That
probably
makes
right.
perfect sense.
Yeah.
It's clear what you want to do, I understand. That if this is going to be a useful time for you, it'd be nice to do something about this issue you're facing about your healthcare providers wanting you to eat more regularly during the day.
An important thing to remember is both patient and provider are experts in chronic illness. The provider is an expert because they have information, training, and experience across large numbers of patients, while the patient has the personal expertise of living with their illness in the context of their life.
I've lost all these reasons, and I think my depression is what causes that.
What's so important about what you're saying is it would be easy for us to get focused immediately on talking about some nitty-gritty diabetes things about eating or exercise, and that would certainly be pointless because, as you're saying, you don't have much get up and go. You don't feel very
Right.
motivated to do anything. You've made efforts before, they haven't really led anywhere. So we really have to talk about what happened to your oomph and what we can do about it.
Right.
When our patients understand that we are interested in their struggles with diabetes and in their perspective on the matter, they are much more likely to be interested in anything we have to say and to be open and interested in addressing their diabetes care. This is what is meant by engaging the patient.